So I have a question for the room, just a quick show of hands. Who here has been a hospital patient in the past couple years? Okay, keep your hands up if you were fully satisfied with the care that you got. Not so many people. It seems like we have some room to improve, which is part of what today is about. I'm Dan Diamond. I'm joined on stage by 4 patients who have amazing stories of their experiences in the healthcare system. And I think this is an interesting panel, especially given that the day has been so focused on industry and industry takeaways. And here we have 4 folks who have lived it from the other side. We've already heard from Corey today, and we're joined by Doug as well, which I don't think is in the handouts that everyone got. But what I'd like to do in the next few minutes is have the patients tell their stories. And they'll get up and step forward and share them with you, and then we'll turn the remainder of the time over to Q&A. So having said that, I'd love to hand the floor now to Garth Callahan, who will step forward. And Garth, can you share your story, please?
Thank you. I'm the napkin notes dad. I'm 45. I've been diagnosed with cancer 4 times in the past 3 years. I've been diagnosed with kidney cancer 3 times and prostate cancer once. And through this entire process, although I love my medical team, I'm tired of them telling me how they feel. Garth, we feel that this is a good treatment plan for you. We feel that you should do this. We feel that you should try this program. And I'd very much like for them to say, Garth, we have some data that says if you do this, 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 and this, you'll get well. So my doctors have told me that I have an 8% chance of making 5 years, and that was about a year ago. One doctor says that the median lifespan for a patient like me is 1 year, and that was about 9 months ago. And one of the reasons why I'm here is that I love my daughter fiercely, and I write her a note every day. So last year, I wrote out enough notes to last her through high school graduation, knowing that I would not be able to deliver those in person. And I would very much like to find a cure, but my doctors have to stop telling me how they feel.
So we've heard from Corey. If Katie can step forward now.
Hi, my name is Katie Helm, and I've had type 1 diabetes for the past 18 years. There's not 1 second of any day in those 18 years that I can't be thinking about my diabetes and where my sugar levels are and how it's going to affect me both short-term and long-term. So I'm able to control my diabetes with an insulin pump and a continuous glucose monitor that I wear 24/7. The insulin pump delivers insulin to me, and the continuous glucose monitor gives me my sugar level every 5 minutes and tells me if I'm going up, if I'm going down, staying straight, and I'm the manager of my disease in the sense that I'm looking at this number and I'm deciding to give myself insulin, to shut off my pump so I'm not getting insulin. And I was lucky enough last month to participate in an artificial pancreas trial, which combines those 2 devices. So as of right now with my diabetes regimen, I could do everything right, and my sugar levels are still a total roller coaster. This artificial pancreas trial basically took my management off the table. The continuous glucose monitor showed my sugar levels, and the pump would read that every 5 minutes and decide what to do every 5 minutes based on where I was, just like a normal person's pancreas would. I was able to eat crazy things that I would feel guilty eating in the past. I had these huge pasta dinners. I'd be drinking sangria and margaritas and ordering dessert at every meal, so I really gave it a test run, and I had to put my trust in that system. I was lucky enough that it worked fantastically. I stayed in such great control, but it wasn't until I got back to my office after the trial that I realized how much I loved it. And I was about 11 o'clock. I looked at the CGM and I thought, oh my gosh, I haven't checked this. I haven't been looking as often as I have. I haven't been being involved with my diabetes because I had gotten so used to sitting back and letting that artificial pancreas have my back. So I couldn't have loved it more. It gave me such quality of life. And another part of that trial was that my doctors and my mom, who was with me, had tablets reading the exact data that was showing on my artificial pancreas, it was also showing for them. So if I wasn't responding to the alerts, they could then have that back. It was exciting for me. It was exciting for my mom, having gone through my childhood years not having that, and just can't wait to have that back in our hands for everyone.
I think my mom would like alerts from me in some form, probably not on my pancreatic functions, but on my alcohol intake perhaps. Doug, I'd like to have you now share your story.
Afternoon. So my story is not just about surviving cancer, but it's really also a story about an amazing breakthrough in cancer treatment. My story starts all the way back in 1996 when I was diagnosed with chronic lymphocytic leukemia, or CLL. I was 49, had a wife and 4 kids, no treatment other than a very risky bone marrow transplant. Had somewhere between 6 and 15 years in terms of prognosis. I was very lucky. I didn't need a lot of treatment for a number of years. But by 2010, about 50% of my bone marrow was cancer. The cancer cells had mutated, so they no longer would respond to standard therapy. And that's when my oncologist sat me down and he said, you know, probably about 2 years without a successful bone marrow transplant. But again, I was very lucky. My oncologist was also the principal investigator for a brand new clinical trial at the University of Pennsylvania, which would use my white cells to kill the cancer. And once it was explained to me, it made sense. It looked like it could work. And frankly, it was an opportunity finally to fight back, you know, not just to be a victim of your cancer. So the process was really pretty simple, as a patient at least. They collected my white cells by apheresis. They sent the cells to lab and transduced them, in other words, taught them how to find and kill the cancer cells. It takes about 2 weeks to do that. And then they returned the cells to me by 3 separate doses and 3 separate days of infusing the cells back into me. And absolutely nothing happened. And it was a little discouraging in the beginning, but 2 weeks later, almost to the day, I woke up with chills and a fever, and it was like having the flu, only a little bit worse. Sometimes it'd be better, sometimes it'd be worse. It was a little over a week before I was hospitalized because my kidneys were starting to get in trouble, and apparently that's because so many cancer cells were dying. It was a couple days after I was admitted to the hospital. My doc came in, and he was just beaming, and he said, 18% of your white cells are these new killer T cells. And he said, they're multiplying, and they're killing cancer. My wife picked me up from the hospital 2 days later. We went to the Annapolis Boat Show, and we bought a sailboat. And you know, you just think about that. You know, for years, I wasn't sure I had a future, and in less than 4 weeks, I was thinking that indeed I had one. It was the very next week that I was sitting with my oncologist, and he said, Doug, we cannot find a single cancer cell in your body. Not one, not in your bone marrow, not in your blood. And at that point in time, I declared victory. I considered myself to be cured, and I could move on with my life. Since that time, 130 patients have been treated. There was just an article published in the New England Journal of Medicine where they did a multicenter trial with 30 patients. 90% of the patients experienced complete remission. This is an incredible breakthrough in cancer treatment. I just had my 4-year checkup. I'm healthy, despite the way I look right now. And I am absolutely convinced that this discovery and others that are happening almost daily now means that we are on the path to finally defeating cancer. Thank you. Thank you.
It really is a remarkable story, the T-cell trial at Penn. And I think Matt Herper wrote a story on that trial and how the patients have performed. It's definitely worth checking out. And Doug alluded to this, but the patch on his eye is not related to his cancer. He just loves being in the hospital so much. He would have raised his hand earlier. He had a procedure earlier this week. So as microphones start circulating, I want to use my right as sitting on the stage and ask the first question, which is, we've heard a lot about the buzzword patient engagement and how important that is. We've heard it from folks throughout the day. I was talking with someone about it at lunch. I want to hear from you four, as four patients who have had to really take charge of your care. What is the industry getting right about this approach to engaging patients, and what is it getting wrong? What have you heard today that didn't jibe with what you now know? And maybe I'll start with Garth, because he's sitting closest to me.
I think that one of the biggest things as I was listening to today is that we're talking about industry as a whole, the healthcare industry. And although the healthcare industry might be moving in a certain direction, it doesn't necessarily mean that our doctors are moving in that direction. And it doesn't necessarily mean that they even know what the direction is. So until my doctors understand how to best engage with me, then it doesn't matter what the industry is doing. And I think as a patient, you and I have discussed this, I took control in the very beginning. And I decided from the moment that I was diagnosed with cancer that I was going to control my engagement with my doctors.
And I know this because we've talked about it. I went to your website when I knew we were going to be talking. There was a photo of you wearing not this sort of outfit, but
yes.
Like
so every time that I go to the doctors, from the second visit through today, I wear a Star Wars shirt. And I love Star Wars, but also I walked in. Exactly, who doesn't?
And also, it's not a Star Wars T-shirt. You should clarify.
Well, okay.
Or sometimes maybe it is.
Sometimes it's a shirt. Sometimes it could be a full Jedi outfit. But I do this because my doctors and the nurses and the people in the facilities know who I am at that point. I'm no longer patient 169527. And they might not know it's Garth, but they know it's the crazy Star Wars guy. And on that second visit, I handed one of my doctors an action figure, a Star Wars action figure, a medical droid. And I said to him, this is the guy who saves the heroes in the movies. It's your job to save me. And that's patient engagement. That turned me from a patient into a person. And I do this in every single facility I go.
And there are lots of other movies that people can think of.
Absolutely. It doesn't need to be that extreme. If you're somebody who likes baking, you could bring in fresh cookies every time. But that's how you're going to differentiate. If we're talking just about cancer, 1.7 million new instances of cancer in the United States this year. How do you become different? Because if you aren't different, you risk being the 1.6999 million.
It's powerful stuff. Corey, you spoke earlier up on stage. You've had folks probably coming up to you throughout the day. What parts of your story resonated the most, and what do you think folks in this room were most surprised to hear about your course of care and how your patient experience has been?
Yeah, the response has been great today. Thank you. I think people are appreciating putting a face to these numbers and to the work. And I think maybe in some ways we are underestimating the patients, but also the advocacy groups that are telling the patients what to go in and tell your oncologist. And I think there's a lack of, especially community doctors, being up to date and engaging research centers with these community doctors that are treating the majority of patients. And I'm sure some of these community doctors still aren't doing full genomic sequencing that would make a difference for patients like me. Another thing I found interesting, I mean, it's been fascinating being on this side of the health industry, but when it comes to data privacy or where is my data going, I'll be completely honest, that's never crossed my mind. To me, this is life or death, and that would be pretty far back in the book for me, which may seem naive to some of you, but it's just, for me, it's so much a focus on what treatment is going to work, what's going to work right now, how many people can know about my case and help me and help others.
Can I respond to something Katie said there?
Sure.
I want my data to be leaked. Please take it, steal it, give it everywhere, because there's going to be somebody else in the world that takes a look at that data and says, oh my goodness, this is the way to go. I absolutely want to share my data and have it everywhere.
It does feel like that's a lurking issue, and some folks in this room probably know it pretty well, but the privacy, interoperability, data sharing, that has not been fully explored. Are there questions from the room? Yeah, up there, Eric.
Hello, I'm Eric Whitney with NPR. I just wonder if any of you, if worrying about how you're going to pay for your healthcare has been a significant part of your experience.
Oh, not at all, no.
I don't know, Katie, do you have any thoughts on that?
You know, I'm lucky enough that my insurance right now, it's not an issue. In terms of clinical trials, I'm just such an advocate. I think, you know, you're helping yourself, you're helping others, you're helping, you know, future children or adults who would be diagnosed with type 1. So there's been no issue. I mean, I'm getting paid for most of them. So at the same time, I'm learning. I'm a lot of times being able to try out new drugs, kind of, you know, under the radar. So I haven't had any significant issues.
And to go back to you once again, Garth, I mean, your financial situation has completely transformed.
It has. A year ago, I couldn't pay my mortgage and sold off my Star Wars collectible set because my medical bills were so high. The drug that I currently take costs about $400 a day. And fortunately, my insurance is kind enough to consider paying for some of it. They don't have to. And honestly, I think about the cost of not only the insurance that I have to pay for, but the things that aren't covered by the insurance. And I'm fortunate that we've flipped. We don't have that financial concern, or isn't as much as before. But I don't think every cancer patient can write a book and then have a movie made after it. I mean, that's not the norm.
Right. Questions from the room? Up there.
Thank you very much for sharing the stories. So my simple question is, what can we do better? That's really what I want to hear. What can we do better?
We talked a little bit about that before coming out here, and I think some of the patient engagement answers get to that a bit. I would be curious, I mean, Doug, you fought leukemia for 15 years. You had various experiences along the way. Could you maybe take a stab at answering that question?
Sure. One of the things that is being done much better now is giving patients access to their own data, which back in the 90s, that wasn't the case. But patient portals now are opening up. I'm being treated at Penn. They have a great website. They keep improving. So obviously, informatics industry is responding by providing patients access to their own test data. I think you're probably aware that there's some movement to actually provide doctor's notes to the patient, which hasn't happened at Penn yet, but I would look forward to it. So it gives, back to that issue of patient control. Be able to go on a website, find out what your test results were, track them. That is moving along in absolutely the right direction. I can tell you one of the things that I've run into now as more as a patient advocate than as a patient is that many of us don't really know what support services are available to us. The connectivity between the medical treatment and the medical healthcare providers and the patient is not that good. I went in every 3 months. I see my doc every 3 months. But, you know, sometimes I didn't want to talk to anybody. Other times I could have used somebody to reach out to me. There isn't, and I've researched this a bit with a number of very prestigious cancer centers. Everybody does it slightly differently, and nobody does it particularly well. And I think there certainly is an informatics solution to that problem of getting the patient better connected to support services, because it's not just the treatment that's important for a patient that's desperately ill.
Corey, I'm curious from your perspective as someone who did not spend as much time in essentially being a professional patient, what do you wish the healthcare system had done differently as you had to get smart in a hurry on the options available to you?
Yeah, I actually got lucky in that my oncologist and I kind of met, when we met for the first time, we both were already asking each other the same questions. I came in saying, what's Tarceva and how can I get it, and am I positive for that mutation? That's the first one I learned about, and he said, I know what you're thinking, okay, you're up to speed, you're young, I feel good, we're gonna find a mutation. Hang tight, takes time to test for this. I know a lot of patients aren't as lucky, and they have to go in and ask these questions themselves, and they'll sometimes have to pay for this genomic sequencing if they run into insurance issues. So for me, after the diagnosis, the journey was somewhat smooth, if you can believe that. Things started to go my way. As far as improvement, I just get so excited by these breakthroughs and the research and all that's happening so quickly. I guess my advice would just be to keep it going and communicate, tell other doctors, tell smaller hospitals, but continue the research and always be up to date because it changes so quickly. I mean, ROS1 is just what I consider a baby mutation. It was just discovered, but it saved me, so.
And just as a reminder for folks who may have missed it this morning, you were stage 4 when you first walked in. Are there any other questions from the room? Yes, last question maybe, the gentleman in the red tie.
Thank you for sharing your stories. Earlier today, there was some dialogue around pricing. And on one side of the story, there's the need to reduce pricing. On the other side, there's the discussion around innovation and finding the new cures. The concern is about pricing being reduced and then not having that innovation. I was wondering if you would like to comment on that. Any one of you.
So just to quickly frame the question, the issue of pricing and how impactful that is.
In the funding of further innovation
Sure.
for future.
Why don't can I throw that to you, Katie? I mean, you've used the artificial pancreas, you have some advocacy expertise.
Sure. I think I kind of see it from the other end, I guess. The funding is really instrumental. I think that also, advocating is huge. And I think that, at least in terms of what I know from JDRF, we work a lot with matching. We're going to give money if we can get a corporation or a pharmaceutical company to put up that money. I think I don't worry so much about that end as much as I do about the other side when it comes out in terms of pricing. I think a lot of people are worried that what they do create won't be something that people can afford. So I offer it to you guys who might have.
Well, I think we're unfortunately out of
Okay.
time, so we'll have to leave it on that cliffhanger of what can be done better. But thank you so much for sharing your stories. Thank you for the questions from the audience.